You don't go trekking in the forest, don't go camping, and don't wade through dirty water. All you do is sit on the balcony for a few minutes in the afternoon. Yet just a few days later, you have a high fever, your whole body aches, and you're hospitalized due to internal bleeding. No one expects that a mosquito bite so tiny. You don't even feel it could make your body collapse in less than a week. And the scary truth is, it's happening every day to millions of people. Dengue fever, also known as the bone break fever, is no longer a disease confined to faraway tropical regions. It's spreading into crowded urban areas, into neighborhoods once thought safe. Climate change, urbanization, and complacency have helped the Aedes aegypti mosquito, the vector of the dengue virus, thrive right around your home. In plant pots, water bottles, broken bowls, or uncovered rooftop tanks. Once you are bitten by a mosquito carrying the virus, it enters your bloodstream and begins a silent invasion. At first, you might think you just have a mild flu, but inside your body, blood vessels start to thin and leak. Plasma seeps out of the vessels, causing fluid loss, low blood pressure, kidney failure, and even internal bleeding. Even more dangerous, the critical phase often starts when you think you're getting better when the fever subsides. You feel better, and you let your guard down. That's exactly when the disease can become most deadly. The symptoms of dengue can fool anyone. You may develop a sudden high fever of 39–40 degrees Celsius, severe headache, nausea, vomiting, and intense pain in the joints and muscles, the feeling of breaking bones. A few days later, you might develop a rash or not. Some people just feel tired and exhausted thinking it's the weather. But if you pay close attention, you'll notice more important warning signs: severe abdominal pain, bleeding gums, nosebleeds, vomiting blood, passing black stools, or feelings of restlessness, shortness of breath, and low blood pressure. Blood tests at this point usually show a sharp drop in platelets, low white blood cells, and increased hematocrit blood is concentrating due to plasma loss. But you don't need to wait for a test to know you're in danger. Just listen to your body. If you have a high fever, extreme fatigue, and live in an area with dengue-carrying mosquitoes, see a doctor immediately. One thing that makes dengue especially dangerous is that many people think, I've had it before, now I'm immune. But that's a deadly mistake. The dengue virus has 4 different serotypes. If you've had one, you're only immune to that specific serotype. If you get infected again with another, your risk of dengue shock, bleeding, and death is even higher. Due to a mechanism called antibody-dependent enhancement that causes your immune system to overreact, damaging your own blood vessels and platelets. In other words, having dengue once isn't necessarily lucky. It could just be your first warning. You might think, I live in the city, it's clean, so I'm safe. But Aedes aegypti is a smart mosquito. They prefer to live near humans, breed in clean water, and bite during the day, especially early morning and late afternoon. You don't need to go anywhere. It's just having stagnant water in plant pots, clogged drains, or empty cans in the backyard gives them the perfect breeding ground. The consequences of not getting timely treatment can be severe, from shock due to blood volume loss, liver damage, gastrointestinal bleeding, acute kidney failure, even death within hours if fluids aren't replaced properly. According to the World Health Organization, each year, around 500,000 people get severe dengue. And tens of thousands die mainly because they arrived at the hospital too late or thought they had recovered. The deadliest aspect of dengue is not its symptoms, but its deception, making you believe you're getting better, while your body is actually collapsing inside. So how do you prevent this disease? Simple, but requires persistence. 3 things to avoid. Don't let water collect around your home. Don't get complacent just because the weather is cool or you see few mosquitoes. And don't think mosquitoes only bite at night. 3 things to do. Wear long sleeves and use mosquito repellent in the morning and evening. Sleep under mosquito nets even during the day if necessary. And check, clean, and eliminate mosquito larvae habitats around your home every week. Also, keep up with local health updates. And if you live in a high-risk area, ask, your doctor about the dengue vaccine when you or your loved one show signs of suspected dengue. Don't wait for test results to act. Rest completely. Hydrate well with oral rehydration solution or coconut water. Closely monitor temperature, vomiting, and urination. Don't use aspirin or ibuprofen as they can worsen bleeding. Use only paracetamol to reduce fever. If you notice rapidly dropping platelets, abdominal pain, or bleeding, go to the hospital immediately for fluids and emergency care. There is a folk remedy of drinking papaya leaf extract to raise platelets, though not officially proven. Many patients use it as an additional measure, but it should never replace medical treatment. The most important thing is not to panic. Be proactive, alert, and act early. Your body is excellent at sending you signals, but you need to listen. When a fever drags on, when fatigue won't go away, when you feel something is off, it's not just the weather or ordinary exhaustion. It might be a warning. And if you react quickly enough, dengue can be treated, controlled, and overcome. Don't wait until you're lying in the emergency room to start caring about a mosquito. Don't underestimate ordinary fevers. Don't let the silence of this disease rob you of your chance to live. You can stop it. You can protect your loved ones. It all starts with being vigilant and not being silent just like its bite.